everybody. My name is James Bishop. I'm the APD of the program. Today, we're going to do a faculty development piece, a little 10-minute presentation on how to effectively deliver bad news to our patients. So as we know, as physicians, one of the more challenging things that we have to do every day is tell our patients bad things. We don't like to do it. We're not good at it. And most of us have had probably no formal training on how to deliver bad news effectively. Believe it or not, there is some science to delivering bad news. So I thought I would go through some of the strategies and techniques that have been developed that help physicians effectively deliver bad news to their patients. So what is bad news? Well, easy enough. Bad news is anything that you hear that makes you worry about your future. So before we talk about how to disclose bad news, it may be worth commenting on, should we disclose bad news? Believe it or not, years ago, if you had cancer, like in the 50s or 60s, physicians would routinely not tell a patient about really bad diagnosis or if you had a really bad prognosis. They thought that this was too psychologically damaging to the patient. Well, studies have looked at that, and now we realize that that is not what we should do. Patients actually do better if we tell them the truth, not surprising. But just because we tell them the truth doesn't mean we should walk in there and, just drop a bomb on them without any concern for their emotional well-being. In this country, of course, we have a moral obligation and a legal obligation to tell patients as much information as they want to know about their disease. We do know that successful delivery of bad news, if you can land on your feet and do this correctly, that there's benefits. It benefits the patient, it benefits the family, and it actually benefits us. We're more honest with our patients, and we're probably better providers if we can be more truthful with our patients. So what are some of the benefits of successful delivery of bad news? Well, if you do it well, your patient has better comprehension of their illness. They are more hopeful. They're more satisfied with the care you provide, and they have improved psychological adjustment to their disease. All right, so how do we do this? How do we successfully tell a patient something bad? Well, psychologists have identified there's, I guess, 4 commonly agreed upon objectives that we should try to hit when we're telling something that's going to be perceived as bad. And this can apply to medicine or even if you're talking to your kids. But for the patient in particular, there's 4 things we want to try to achieve. We want to gain their perspective, meaning their understanding of their condition. We want to share information with them that they understand. We want to emotionally support them. And then finally, after that, we want to summarize and develop a strategy of care. And this gets to the bulk of the talk. How do we do this? How do we land these 4 objectives that we just talked about? Well, years ago, some physicians out of MD Anderson, some oncologists realized that most of their physicians just felt untrained and unprepared to effectively deliver bad news to their cancer patients. And they wanted to come up with a program that incorporated achieving these 4 objectives that we just talked about. And so they came up with a strategy. This is a validated 6-step process called SPIKES, and it's a mnemonic. And this stands for setting, perception, invitation, knowledge, emotion, and summary. And the idea is if you're going to tell your patient something bad, if you go through these 6 steps, you should be much more effective at delivering this information and still supporting them emotionally. So it starts with S, the setting. I think most of us are pretty good at this. If you're going to tell somebody, a patient, something really bad, we want to make sure we have the appropriate setting. And a lot of this is just about showing courtesy and respect to the patient. You're about to deliver something fairly significant to this patient's life, and you want to provide them with as much courtesy and respect as possible. So choose your setting appropriately. I think we do a pretty good job of this. We often use that private room for families, but you want to choose a comfortable private area. You want to minimize your distractions, right? Sit down, turn off your phone, and you want to ask the patient if they would like to include any family members. After the setting is chosen and we go with that, we start with the next is perception. And this is something that, I'll be honest, I don't know if you guys do this. I don't do this, and I think it's great. But we're so anxious to tell the patient the results of their CAT scan that we rush through this. And perception is where we ask the patient and try to gain an understanding of what do they already know about their disease. And the idea here is, we don't want to talk down to the patient. We don't want to talk beneath them, but we don't want to talk above them either, right? We should try to figure out, is this a doctor you're talking to, or is this someone who has very little knowledge of their health condition? And this will help us understand what their current understanding of their disease is. And it gives us a good starting point for the conversation. The next step is I, and this stands for invitation. And this is also something that I think most of us don't do, but I think it's really great. Before you disclose bad news, you should ask permission. And it's the patient's information. We're just looking at it temporarily. This is their body. This is their future. We should ask permission to tell them something that they might not want to hear. And so if you have a CAT scan or an X-ray and it shows something unpleasant, you probably should sit down and say, hey, is it okay if we talked about your test results? And if they give you that permission, you may want to ask them how much they want to know, how much detail, do they want family members involved in this conversation, etc. Once we've gone through those steps, this is probably the easier step. This is the knowledge. And this is where we do what we do. We tell them medical information. But kind of the highlight of this strategy is, we want to explain their condition in plain English. Talk at their level of understanding. You want to avoid unfamiliar terms like metastasis or ascites, and try to tailor the speech to their understanding of their disease. And we're starting to get towards the end. This is step 5 of 6, and this is emotion and empathy. I think this is the step that most of us probably struggle with the most. We don't want to get caught up in the patient's emotion. We don't want to make them sad. And so a lot of us just jump through the knowledge, and we try to skip this part of the healing process. But it's something we really should try to focus on. And basically, it's when you tell someone a bad news, you want to wait for their emotion. And once they show that emotion, like you tell your patient they have cancer, you want to look at them, and if they start crying, you want to recognize that. You want to identify that they're sad. And then they actually recommend that you name it and you validate that emotion. So if the patient starts crying, you want to identify it, and then you want to say, I see that you're upset. And then you want to say something validating, like, I can understand why you felt this way. And this, I think, is very important. If you've ever, I don't know if you ever had loss in your family, but there are a lot of people that will sympathize with you, but there's some people that will empathize. They'll help you shoulder the burden of something bad. And they validate that you're feeling sad. And that's very powerful. And it's something I think we all could work on. So once they process that emotion and all of that's out, now they're ready to listen. And we get to our final step, which is to summarize what we told them and come up with a strategy. And some highlights here: we want to confirm their understanding of what we told them, and we want to identify the next steps in their care. So that is my talk for today, guys. Those are the 6 steps. I hope you can try them. Here's some references. If you have any questions, please let me know.